Thank you, Wade. Good morning to you. Can you hear my voice okay? Thank you. It's a privilege to be here this morning, and I'd like to continue and talk about a few things related to the onset of hearing loss. And then we're going to talk also about some possible signs and where they can occur in terms of different levels of activity. And then we're going to look at some tips or ideas to help improve the ability to communicate with someone with a possible hearing loss. And these tips apply to family, friends, and people who are coming into contact with someone who can have a possible hearing loss. As Dr. Waltz mentioned, there are various and multiple causes for hearing loss because there are so many conditions that can affect the hearing function. We can have two major ways of developing the onset of hearing loss. One is the subtle or insidious or slowly emerging hearing loss. It is something that occurs mostly with age. Repeated exposure to loud levels of sounds can lead to a more slowly, gradually, more insidious type of hearing loss over time. There are also conditions that can cause a rapid or a quick onset. Someone goes to bed at night having good hearing, the next morning wakes up and all of a sudden something happened. There's fullness, the person cannot hear very well. That is a different kind of onset. It's a rapid, quick onset, and it gives us ideas that something else might be going on besides just age or other slow factors. In both cases, there are common indicators that we can look for in terms of understanding or perceiving whether there is a loss or not. As we all know, the social aspect of our lives is a significant one. We like to interact in our families. We like to interact with our friends. We like to interact with our neighbors. So this is where we can look at for possible signs of hearing loss. In the social sphere, if someone would start asking repeated questions for clarifications, that is a possible sign of hearing loss. Some people can hear pretty well, but they don't understand. So either a loss of hearing or a decreased sense of perception or understanding speech in communication is another sign of possible hearing loss. And as a medical professional, as an audiologist, I have had patients come to me and say, I cannot hear my nephew's voice. I cannot hear very well my wife's voice. And that's typical when there's a hearing loss because those voices tend to have more high-pitched sounds present when we talk. And if there's a loss that affects those higher pitch sounds, then someone would have a hard time understanding or hearing what the wife, spouse, or children will say. When interacting with someone with a hearing loss, the perception is also that people talking to that person are not speaking very clearly. They are mumbling. They are not very clear in the way they speak. And probably you've witnessed or saw examples like that. It's, for me as a person with hearing loss, if I would have a hearing loss, I would feel that someone perhaps is not speaking very clearly and say, hey, I don't think there's a problem with me. I think you may not speak at your best. So. And there is some truth to that. If we tend to speak at a low voice and if there is competing noise around, it makes it harder for someone with hearing loss to hear or understand. But this is a good sign a sign that can indicate something may not work very well in terms of the hearing function. As I alluded just a minute before, noisy situations are competing with us in terms of communication. It makes it harder for us to hear. If someone has a hard time understanding or hearing speech, particularly in a noisy situation, then there's something probably going on with the hearing function that can prevent them from getting all the information. At home, a person with a hearing loss can have the stereo, the TV, or any other CD players, music players. They have them turned up with the volume high so they can hear very well. If others at home would like to have a more comfortable, lower level of the volume, a person with a hearing loss would like to have the volume cranked up. It is a possible sign of hearing loss. And a person with a hearing loss will occasionally, or frequently, if that is the case, depending on the severity of the loss, will pay more attention to the facial expression and be very attentive to the movement of the lips. We call that a lip reading, to enhance the auditory information with the visual information in order to understand better, to augment the message that was presented. Hearing loss can also affect us emotionally, not only at a social level. Someone with a hearing loss will feel stressed out if they have to strain listening and understanding to different types of communications, different situations also. There's a sense of frustration because I'm not getting all the message. I'm missing out on some of the sounds or some of the words that were presented to me. And this frustration can also turn into embarrassment when it comes to meeting new people or to engage in social activities, social situations, going to a party, family reunion. Those things can affect us at an emotional level, probably more than we can understand physically or watch. And this is something that people with hearing loss probably can testify to that. From a medical standpoint, there are also signs that we can look at. If there is a history of hearing loss in the family, we can expect for the person to have a more vulnerable, a more predisposed way to developing a hearing loss. If there's medication that can affect hearing, there are different medical conditions that may call for medical intervention, and medication needs to be prescribed and taken. There are what we call ototoxic drugs, drugs that do affect the hearing function as a side effect. If there is diabetes or any heart problem, thyroid problems, those can also affect the hearing function. If there is exposure to high levels of noise or sounds, it can either be a traumatic sound exposure, like a blast, or it can be a continuous or periodic exposure to levels that are damaging for the hearing system, like shooting guns, being in a construction environment where there are lots of loud and annoying noises. All those things can affect over time or even rapidly the hearing function. If there's ringing in the ears, that is another medical sign that something is not working well in the hearing system. Some suggestions for family and friends to help improve the communication with someone who has hearing loss. It is very, very important to face the person we're talking to, and this applies not only to people with hearing loss, but to us all. When we talk to people, and especially when you want to communicate important messages, we choose to face each other and we want to stay close to that person so we can bring that message clearly. We want to have their attention because this is important when we communicate. And when we speak, we should speak at a normal, comfortable level. It is something that tends to be harder for us to do if the person asks for a repetition. We tend to speak louder or shout, thinking that this will solve the problem. The reality is that if we are facing the person at close proximity, it is rather easier to deliver a message if we speak clearly with good articulation speech, without shouting, because when we do that, the person can understand us better. And there is another, actually, a rather good tip. When we are faced with the challenge of background noise, like in a restaurant or noises around us on the street or in places that are noisy, we should actually avoid transmitting or communicating important messages when we are at that particular site or place. We should try and find ways to engage in transmitting those messages in a quieter setting so we can maximize our chances for good communication. And continuing, we should face the person being at close proximity, but also provide good visual cues so that the message that we present auditorily will be also understood clearly in a visual sense. We should preface the topic. If we want to talk about a cruise experience, we should introduce the topic. We should not just jump into the topic. It helps prepare the person knowing what the topic will be. When we are asked for repeating a sentence or a question, rather than saying the same thing one more time, we should aim at clarifying the message or saying the same idea with different words so that the person will understand or have a better chance to understand what the actual message is. I will turn it on to Wade. He will continue to talk about